28-year-old man is brought to the emergency room barely conscious after feeling drowsy and falling to the floor during a presentation several hours ago. His colleague who accompanied him said he has had similar episodes 5 times in the last 3 months. He has had no significant past medical history and takes no medications. His blood pressure is 110/80 millimeter of mercury and his pulse is 114 per minute. Capillary blood glucose is 15 milligram per deciliter. Intravenous dextrose with thiamine is started and he rapidly regains consciousness. A CT scan of the abdomen is performed, which reveals a tumor in the pancreas. Which of the following relative laboratory findings would you most likely expect to find in this patient? So, most of you got this right. That's great. The diagnosis for this is carpal tunnel syndrome. Okay. So, once again, certain clues, okay, in the question. First one being a software analyst, okay, her job. And one clue that comes on later is the fact that it's aggravated by the end of the workday and absent on most off days. So it kind of points towards how it's aggravated only on doing her work. And since she's a software analyst, you can automatically assume she has a lot of work on the computer. She's constantly moving her fingers, okay, likely to develop carpal tunnel syndrome, okay, that presents with your tingling, numbness, okay, for whatever 2 months. Now she was diagnosed with type 1 diabetes 2 years ago, okay. If you look at option D, diabetic neuropathy is one of the options available, okay, as one of the answers. But the fact that she was only diagnosed 2 years ago, it's very unlikely for a patient to present with neuropathy this early on after diagnosis. Look, and she's also taking insulin. Very, very unlikely. This usually presents years and years after the diagnosis. Okay, so you can just rule it out. The next thing is sexually active but has had irregular periods for the past 3 months. Okay, sexually active, you can ignore that for now. Irregular periods for the past 3 months kind of points towards, some sort of, she's having some sort of menstrual abnormality, which just confirms hypothyroidism. Okay, so carpal tunnel syndrome is one of the features of hypothyroidism, and the fact that she's also having menstrual irregularities, okay, kind of just confirms that. So hypothyroidism is one of the causes of carpal tunnel syndrome. There are a few other causes. Another very, very important one that's commonly tested is pregnancy, but they're very clearly mentioned that a urine pregnancy test result is negative. So though it's not mentioned as an option, I'm just telling you in general. So since you know it's not pregnancy, the next best thing you can think of is hypothyroidism. Okay, acute intermittent porphyria can present with peripheral neuropathy, very similar to diabetic neuropathy, but other features like port wine colored urine or psychiatric disturbances, okay, all this would definitely be mentioned, at least the color of the urine. Okay, something along that line will definitely be mentioned. They will not just mention something as like tingling and numbness in both hands. And like I mentioned, the fact you kind of correlate the occupation or the profession of the patient with the presenting complaint, it's carpal tunnel syndrome, which is more of a compressive neuropathy rather than this form of neuropathy. Okay. Next one is ALS. ALS purely involves only the motor system, has absolutely no sensory component. Okay, usually it's an upper motor neuron and lower motor neuron. Okay, it involves lesions in both. So with that itself, no sensory component, rule it out. Multiple sclerosis, they will 100% mention the relapsing and remitting nature of the disease if they expect you to arrive at a diagnosis of multiple sclerosis. None of that has been mentioned in this case. You can just rule it out.
Thanks for watching. Please give a thumbs up and subscribe for more.